I am Gary Dorst, the founder of Professional Predictive Models, LLC. We are a data analysis and statistical modeling company. We take the data that you have collected and turn it into useful information. This video shows what can be done with public data. This is data that we did not collect, but through careful analysis can yield answers to important questions such as the ones examined in this video. Suicides. The growing number of suicides constitutes a public health crisis on the level similar to other public health crises such as the opioid epidemic. Suicide has been a topic of frequent and ongoing coverage in numerous publications such as the New York Times and the Washington Post. I decided to analyze the suicide-related data made available by the Centers for Disease Control. I wanted to see if the CDC data could answer the who, what, when, where, and why questions, as well as answer the question, just how bad is it likely to get in the near term? What I found does to some degree address all of these questions. We'll start at a high level and then drill down. I want to point out that every graph shows trend lines and trend line equations in the upper left of the graph. These equations can be used to predict future outcomes and the speed at which things change, and to determine if there is a linear or steady increase, or an accelerating rate of increase, or even a decelerating rate of change. I'll point out areas of concern that the trend lines reveal. For example, this graph and its trend line show a rate of change that is accelerating. With each passing year, the rate of change is getting worse at an increasing rate. Unfortunately, you'll see numerous trend lines like this one. Could age indicate possible risk of suicide? When I was in college, we were told that the older you were, the more likely you would be to commit suicide. And if you look at the graph, you'll notice that from 1999 to 2000, this seems to be true. The older you become, the more you lose friends, family, one spouse, much of what you value in life. And the thought was that older people become increasingly depressed and less likely to see the value in continuing to live. However, as the years have passed, this explanation for suicide relative to other age groups looks less and less to be a viable explanation. Look at the 75 to 84-year-olds now. They have a suicide rate similar to people who are 35 to 44. People who are 65 to 74 have the same rate as people who are 25 to 34. The two highest rates are people who are 45 to 54 and 55 to 64. Old age appears not to be the major factor in the strong and dramatic increase in suicide today. It's middle-aged people who are at greatest risk for committing suicide. What is interesting is that as people reach retirement age, the age where Medicare and Social Security become available, there's a dramatic shift to a lower likelihood of committing suicide. These numbers suggest the following explanation. People who become unemployed in their late 40s, 50s, and early 60s often have a difficult time finding other employment, especially jobs that paid as well as the job that they lost with the benefits that they had before. And social norms put pressure on people to find a job to support themselves as well as their family. This puts an enormous amount of pressure on people caught in this situation to live up to and perform to a standard that they're not capable of reaching. Suicide, therefore, becomes a way out, a means of escape from what they consider a situation that they cannot escape from any other way. And a gun to the head might seem, to them, the fastest and easiest way out. Could gender be a predictor of the risk of suicide? The answer is a profound yes, but with some interesting caveats as we shall soon discover. Let's take a look at the graph. White males have the highest suicide rate, followed by all males. However, remove white males from the data set, and non-white males have the third highest suicide rate, a higher rate than any group of females, but less than half of all males and only 44% of white males. The next group is white females, followed by all females. And the group with the lowest suicide rate are non-white females, who have a very low suicide rate. The trend lines are worth noting. Both non-white trend lines have no real detectable rate of increase. They're not perfectly horizontal, but it's difficult to state with confidence that there's any detectable increase in the rate of suicide. Whites, both male and female, on the other hand, have clearly detectable rates of increasing suicide. The trend line for white males is particularly concerning. The predicted rate of increase is 0.38. That would suggest that in 2021, the suicide rate for white males would be 26.7 per 100,000, or between 33 and 35,000 white males dying by their own hand that year, and continuing to increase in rate and numbers. Highest and lowest risk for suicide. I have examined multiple factors and have determined the characteristics of those who are most and least at risk for suicide. White males, ages 45 to 54, who live in a non-metro area, an area of open country and small towns, are far and away the most likely to commit suicide. The least at risk are Asian and African American females ages 25 to 34 and 65 to 74 who live in a large metropolitan area such as Chicago. For comparison purposes, I have added the overall suicide rate. And additionally, I have added a line that shows the rate at which the group at greatest risk used a firearm. On average, a firearm is used 2/3 of the time. Moreover, I believe it's worth noting that the blue and the red lines have similar paths. Suicide should not be regarded solely as a medical, psychiatric, or psychological problem, not stemming just from depression or desperation, but also from a desire to escape from what may seem to be an impossible economic or financial situation. Thus, we need to recognize that suicide may not only be a social problem, but a socio-economic one as well. But a realization occurs as one works through the data. The realization: white males 45 to 64, especially those that living in non-metropolitan areas, are the most likely by far to commit suicide, yet they seem to be the ones least likely to support needed programs and funding. To stem the tide of an increasing suicide rate, the socio-economic conditions that drive people to suicide need to be addressed by strengthening the social safety net. We know this because once people reach a point in life where they have access to retirement benefits, the suicide rate drops dramatically. I believe that we'll continue to read about the massive and increasing suicide rate, but nothing will be done to stem the rising tide, because those who should care don't.